This video is related to the change control management in the pharmaceutical industry. It is commonly abbreviated as CCN or CC or change control. And we should be aware about this term and we should know what is change control and what is change control management. I welcome all the viewers to this informative topic, and in this video we are going to learn regarding the change control management, what are the concepts, what is the procedure, and why change control management is required. The topic is change control management for ensuring controlled, safe and effective changes. There are the requirements for changes to be done in the products, to be done in the systems, to be done in the projects. So what is change control management? It is a process, or you can say the structured process, to study, to evaluate, approve and implement the changes in the pharmaceutical industry, in the systems, products and the projects. The change control management system ensures changes are controlled, are traceable, compliant, authorized, and these changes are effective. So these changes are managed through the change control system and managed through the formal workflow and is checked by or overseen by the change control board. It helps to reduce the errors, risk, negative impacts, disruptions of the changes on the ongoing operations. Key concept: what change control really means. It is a systematic approach to introduce changes in a controlled and coordinated way. It governs modifications in project scope, timeline, resources, or system features. The change control establishes a framework with clear steps, roles, and documentation standards, including oversight by the CCB. Many of the times in many of the organizations, the change control board is not there as a specific, but the change control is taken by the respective department and it is approved by the quality assurance. So there is a change control note in which the changes are written and their impact is assessed by different departments, and finally it is approved by the quality assurance department. We should know why change control is important. What is the benefit? So it minimizes the risk, it maintains quality and stability, it promotes compliance, ensures traceability and accountability, and optimizes the resources. It minimizes the risk as it evaluates potential issues in advance to prevent errors or disruptions. It promotes compliance. It is essential in regulated environments like GMP environment to meet the legal and quality standards. It helps to maintain quality and stability by ensuring ongoing operations or projects remain stable and reliable. Ensures accountability and traceability of all the records, and it records all the changes and identifies responsible parties. That means the departments. Optimizes resources, avoids unnecessary and unapproved changes, saving the time and effort. Now, what is the typical process steps for the change control? First is change request. Submit a formal request describing the proposed change. Impact assessment. Analyze the effect on scope, budget, timeline, risk and quality. Review and approval. Relevant stakeholders or CCB approve, reject or defer the changes. Then implementation. Authorized personnel carry out the approved change. Verification and validation. Test and confirm the changes achieves the intended outcome. For example, if you have taken a change control for some machines, for some process. So it should be effective and it should achieve the required target. Otherwise, that change control will be of no use. Documentation, update records, SOPs, and maintain the change log in the process for making the records for the audit purpose. Now, what are the building blocks for the change control? So, change control board, generally, many of the times it is QA department, standard operating procedures, change logs that record all the submitted, approved, and rejected changes so that the changes can be tracked, and the impact assessment. Impact assessment is for analysis to understand positive and negative consequences of each proposed change. Practical insights. So why organizations use change control? Because this change control helps to keep the projects and systems stable even when adjustments are needed. Provides clear documented trail for audit and regulatory compliance. Encourages collaboration and accountability among the teams. It helps to make informed decisions, avoiding unnecessary disruptions or wasted resources. These are the practical insights for the change control. Change control management is a very crucial process in the pharmaceutical industry. It takes time. It involves all the department. It is initiated by the core department in which the change control is to be done or some changes are required to be done. It checks the assessment, it checks the impact, do the risk assessment, and then the impact is studied, and after that the change control is approved. So this is the information regarding change control. Thank you for watching the video.